this Delta variant um, results in viral titers about 1,000 times higher than what you got in the ancestral lineage, the original variant that was there. So in other words, people are producing more of the virus and they're shedding it quite a bit. And there's some additional evidence that the vaccinated are shedding the virus just as much as the unvaccinated. There's evidence of breakthrough infections amongst the vaccinated. All right. And there's evidence that those breakthrough infections, while they're not putting them in the hospital the same way, and they're not at risk of severe, critical, or fatal disease to nearly the same extent. So the vaccine is really towing the line and holding out against people suffering more severe complications. But they are capable of becoming infected, and they are capable of passing the virus on to other people. We really need to use those non-pharmaceutical interventions to help stem the spread of the virus, even amongst people who are vaccinated. So mask up, socially distance, avoid large gatherings, do this to slow the spread of this much more transmissible variant. It didn't surprise a lot of us. And a lot of us, when we spoke to the media and talked about this, we issued a lot of caveats that there are variants that may arise in the future that are going to be much more troublesome. If they are capable of a process called immune escape, which allows for repeat and breakthrough infections and renders the vaccines less effective, we're going to have a problem again, and we're going to have to deal with it. I think more of the problem might have been messaging. I personally did not agree with the CDC when they issued the relaxation of the masking policy and started relaxing social distancing. I thought it was very premature. I thought there were too many variants on the horizon, not the Delta ones, but actually the Beta and Gamma, which were already problematic enough and had indications that they could possibly break through vaccinations and could cause repeat infections amongst those who've been infected but not vaccinated. And we have to get away from the narrative. And I think the narrative, honestly, has been supported quite a bit by media about focusing on the protests on one side of the political aisle about vaccine passports and the need to have some sort of restriction on those who are unvaccinated and how this offends civil liberties and this gets into people's health privacy. You know, I think in some sense, we really needed leaders to come up and say, political leaders, maybe on the other side, say, we need to get over this. All right. You want to go to a restaurant, you're going to need to be vaccinated. You can't put people at risk. This is an ongoing challenge that we are confronting. We are going to have to deal with this virus for quite some time. We would like to move to a post-pandemic phase, but that's really going to be contingent on how much people vaccinate and what kind of variants emerge anywhere in the world, including in the United States.